Hey everyone, it's Dr. Charlotte Hodges, and today I wanted to talk about everybody's favorite topic, dumping syndrome. So I get a lot of questions about this during my patients' initial consultations. I also get a lot of these questions via email. My staff get these questions, and so I thought that this would be a really good topic because there are a little misconceptions about what dumping syndrome really is, and then I just want to kind of give you a couple little tricks on how best to combat dumping syndrome. So to get started, what's dumping syndrome? I think there's a misconception that whenever somebody hears dumping, that they think that is diarrhea or vomiting. And really what dumping syndrome is it is a series of symptoms that a patient will experience when they take in a little bit too much carbohydrate. So if you take in too much carb, that is going to cause a bump in your glucose levels and then an additional bump in your insulin. What happens is after these surgeries, if you have a really big spike in your insulin and then a big drop, that's when you begin to experience dumping syndrome. And so dumping syndrome is not diarrhea, but what it really is are the symptoms that you're experiencing from that drop in your blood sugar or hypoglycemia. So that's low blood sugar. So the symptoms that you're actually feeling are really upper GI symptoms. You can get nauseated, you can get sweat, you can have your heart race. Now some people do get sick to their stomach, and some people may have like an upset stomach or some diarrhea. That's typically though seen in patients that might have a little bit too much fat in their diet or in their meal. But for the most part, whenever we're talking about dumping syndrome, we're looking at this collection of symptoms that are more upper GI related. Now, it does not mean that if you eat something really sweet, you're going to get every one of those. For instance, like my husband, whenever he was in his his PsyD program, and he was doing, I think it was his internship. He like lived out of town. He lived in Rockdale, which is right outside of Austin. And I remember he would eat hot tamales. You know those little candies, those little hot tamale candies? And he would be eating them, and I could hear him chomping on them while we were talking on the phone at night. And he's like, baby, my heart's just racing. And I'm like, Collins, stop eating the hot tamales. You can't eat all that sugar. That's dumping syndrome. I'll have other patients that will give me a call, and or I'll see them for one of their follow-up visits, and they're like, man, you know, I just seem to get nauseated in the afternoons. And so we start talking about what they're eating or what they're not eating, and then they'll tell me that that's usually whenever they go and have like an afternoon coffee drink as a pick-me-up. And it's like a caramel latte. And so even though they're using a low-fat milk, they're using a higher sugar syrup. And it's that sugar in the afternoon, not really the fact that it's the afternoon, but it's that sugar that's causing the dumping syndrome. And so what are some things that you can do to help to prevent dumping syndrome? Because I'll be very honest, once you kind of start down that path of the dumping syndrome, unfortunately, you almost just have to let it ride out. It's going to be 30 to 40 minutes of just hell. I wish I could tell you something different, but you can take Zofran or an anti-nausea medicine. Sometimes people might even try to take a little bit of another carbohydrate to try to bring their sugars up, but that could cause another compensatory drop in their blood sugar. And so, unfortunately, I feel like once people kind of begin to have their dumping episode, the best thing you can do is just like take it easy, maybe sip on some water. You can try to take an antiemetic, but that may or may not help. You really just got to let these symptoms ride out. So who is at risk? Traditionally, people think that it's somebody that's undergone a gastric bypass or a duodenal switch, but I will tell you, I have plenty of sleeve patients that will experience dumping syndrome. So that's number one. I think that that's one misconception. The other misconception is that patients can develop dumping syndrome if they eat a cupcake or if they have a full sugar soda. Well, you can get dumping syndrome from any carbohydrate. Whenever you eat food, particularly carbohydrate, it gets broken down to its little small molecular piece called glucose. So that's one single ring sugar. You'll get that right on whenever you play Jeopardy next time. And so it doesn't matter if you're having something as simple as a cupcake, or if you're having maybe different pieces of fruit. All of those are going to be broken down to a simple sugar. And so things that can elicit a stronger dumping syndrome or make you predisposed to that are going to be carbohydrates that have a higher glycemic index. And I like to go onto Pinterest or YouTube or wherever. They always will have big long lists of high glycemic index foods and lower glycemic index foods. A higher glycemic index food is going to be something that has a lot of simple sugars, and it's going to elicit a really high peak of insulin and then a very big drop in your glucose. So that would be fruits like watermelon, some of the citrus fruit, peaches. Let's see, what else? Clearly, if you're doing like a candy, like a cupcake, something like that. You even need to be a little wary of some of the artificial sweeteners. Some of those sugar alcohols can also elicit the same dumping response as well. Carbohydrates that will elicit or put you at less of a risk for dumping syndrome is going to be a low glycemic index carbohydrate. So if you're going to pick a fruit with a darker skin. So maybe a blueberry or a raspberry or a strawberry. But some of those really juicy citrus fruits, those are going to be high glycemic index. You're definitely going to be at a higher risk for developing dumping syndrome. If you like beans, we live in Texas. I love my Mexican food. If I'm going to have a bean, a better option is going to be a black bean as opposed to a pinto bean. And when you're going out, the thing that's going to have the highest glycemic index is going to be a refried bean, followed by a pinto bean, followed by a black bean. So if you're concerned about whether or not this particular carb is going to elicit a response, go with a black bean. Other things that can cause dumping syndrome are going to be different starchy vegetables, rice, potatoes, even some breads. And so sometimes it's not the overall glycemic index of the carbohydrate. Sometimes it's just the amount that you're eating. I remember whenever my husband initially had his gastric bypass, he ate very clean and he ate very well, but sometimes he was finding that if he was eating a lot of lower glycemic index carbs, but a lot throughout the day, towards the end of the day, he would have some dumping syndrome. So everybody's going to have a little bit of a threshold. Try to keep your carbohydrate per meal. Keep that number below double digits, most certainly. Also, what are some other things that can elicit this drop in your blood sugar? If you wait too long to eat, or if you skip a meal, all of those things are going to cause drops in your blood sugar. So if you're going along throughout the day, you wake up in the morning, you have some breakfast, and let's say you have an egg or you have your protein shake, but then you don't have lunch till 2, you're probably going to feel a little nauseated between breakfast time and the time that you eat lunch. And then if your lunch is more carbohydrate heavy, you're going to be at a much higher risk for having a drop in your blood sugar within 30 to 45 minutes after you eat. Another thing that can happen is, let's say you have your breakfast and then you have your lunch and then you have a mid-afternoon snack, but that mid-afternoon snack is just a piece of fruit. There are going to be some patients that are going to have a drop in their blood sugar, and you're going to notice that 30 to 45 minutes after you eat, you just kind of feel lousy. Sometimes people might pass out. Sometimes people just feel draggy. Those are all drops in your blood sugar. Those are all variations of dumping syndrome. So what I recommend is, if you're going to have that mid-afternoon snack, just because, well, you have that mental fatigue, you have that brain fog, there's nothing inherently wrong with that. But if you're going to have a carbohydrate, you need to have an equal amount of protein along with it, so that that protein helps to balance out any fluctuations in the glucose and fluctuations in the insulin. So I think some of the take-home points of this are, anybody is going to be at risk for dumping syndrome, number one. Number two, early on in your recovery, you might be a bit more sensitive to glucose. I literally just got through seeing a patient this morning, and she was having a lot of issues with dumping. But for her right now, she's about 2 months out from surgery. She's just very sensitive to glucose and different carbs. I told her this is not anything that's going to last forever. You just have to power through. And I gave her some different dietary changes and strategies to help keep her from having dumping. So don't wait too long to eat. Don't skip a meal. You need to know that regardless of the surgery that you've had, you are going to be at risk for dumping syndrome. And I think the last thing is, you know, I want you to know that dumping syndrome is not the end of the world. It might feel at the time that's the end of the world, but it's not the end of the world. You haven't messed up anything on the inside, but it certainly is your body telling you to not do it again. So did this kind of help? Did this kind of answer some of you guys' questions? Please share this with your friends. I get this question a lot. So hope you guys found this helpful, and look forward to chatting with you guys soon. Bye.